Yes, ma'am.
Okay. So in the first one, I already told you what you have to remember. In the second definition, you have to remember these are some guidelines. Ethics is nothing but some guideline which is to help us to perform our practice and standard of personal responsibility. Here, personal responsibility means for a nurse in a ward, okay, for a nursing personnel in a ward or any kind of medical personnel, how they have to behave with the people, how they have to carry out their responsibility. You have seen, I think, through social media, or any kind of messages you have seen how there is a small example how nurses used to hold their bladder for long time, okay, for caring the giving care to the patient or any kind of you know more than me because maximum of you have more experience than me in clinical. Okay, so that is the things you have experience. So the personal responsibility is different for every nursing personnel in a hospital. So how you will carry forward in a standard way depend on you. So ethics is to help you perform that. Because sometimes what happen in if you are staying with your family, if you are staying with your known person, we used to show our temper tantrum, we used to show our angriness, we used to show all that kind of emotion. But in hospital, you have to control yourself. You have to maintain only the standard of the personal responsibility. So in the second point, you remember according to Layli, MS, and Juanita Lee. Okay, so according to them, these are nothing but there are some guidelines which is helping us to perform and standard of the personal responsibility. Two things you remember: one is personal responsibility, and another one is guideline for performance. Okay, these are some terminology, medical terminology using by nursing personnel. So remember, these are the points. If you are not able to remember anything about the definition of ethics, just remember these are some set of guidelines, which will help you yourself to perform and maintain your standard of personal responsibility. Is not it simple?
Yes, ma'am.
Next is, this slide is visible for everybody?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
So those are general ethics. So if exam, if it is mentioned as a ethics or nursing ethics, okay, sometimes the question used to come, they define ethics, explain what is nursing ethics, like that. And sometimes maximum time question used to come, define ethics in nursing profession. And sometimes it used to come, the importance of ethics in nursing. Okay, so you have to understand what you have to write in your paper. So that's why based on those questions, okay, I have verified 2 years, 4 years question. Based on that only I am preparing this content. Are you understanding? Okay, so please concentrate. I will send the slide, no way, no doubt in that. But remember what I am actually explaining. Okay, I am giving you to the point how you are going to do your paper. So in nursing ethics, you have to remember, you have to mention the first definition. The ethical standard that govern and guide nurses. The nursing ethics are those standards which is to govern and guide us in everyday practice, such as being truthful with client, respecting client's confidentiality, and advocating on behalf of client. Okay, so you know how you have to be very truthful with the client. You know what is scrub nurse? What is that? Scrub nurse?
One who assists in
Inside the
OT.
inside the operation theater, okay, do OT nurses. So what happens sometimes, if you have seen even in movies, okay, I'm just trying to explain you very simple way. So what happened here, you know the patient actually going to die within half an hour, or patient is actually going to die now only. So when, as soon as you used to come out from the OT or operation room, you know your heart is how much heavy, but still you have to tell truth to their dosage. You cannot say just for namesake, or just to even to handle your own patients or anxiety that no, he is okay, he is fine. You cannot say that. You have to tell he is no more, or you have to say. Okay, that is the truthful with their clients. Here being truthful with their clients is meaning that. Okay, so ethics is helping us to do that. Ethics is realizing us that why we have to tell that. Because see, if you tell a simple lie to some people, it will affect their whole life. वो नर्स ने तो बोला था, she told that वो जिंदा रहेगा, he will be capable to alive, but now how this happened? So if you tell a lie, you have to cover it up for whole life. So being a truthful with a client, only in nursing profession or medical profession we have to maintain that. Other profession, so many lies is there, so many. I'm not telling the other profession are bad, but they have some business with. But in medical, you cannot say even one lie with the patient life. Okay, that is very, very important, how you are maintaining your ethical guidelines, and even how ethics is helping you to maintaining that guidelines. Respecting clients' confidentiality and advocating on behalf of client. So here 3 things you remember: being truthfulness, another one is respecting clients' confidentiality. What is confidentiality is? Fanai is not there.
See, ma'am.
What is confidentiality?
Privacy.
Privacy. Okay, what kind of privacy it is?
Patients details.
You know something about the patient have shared with you with a belief, with a faith that you are not going to share with anybody. He will be very insecure, he will lose his mind if you tell somebody to that. So sometimes doctors and even you and even the patient family know some confidentiality, but the patient don't know. So you are nobody to tell that things to the patient. So from where with this knowledge and this guideline we got from ethical principles. Okay. So one more thing I will explain you, one example I will give you. Before you have seen over the patient profile, okay, the hard copy, they used to write, please wear gloves, the patient is HIV positive. Have you observed that anybody before in hospitals? Nobody, no one observed that. Please wear gloves, please maintain. Have you observed that? Yes. They used to write, right? So nowadays, have you seen that? Have you seen that?
No, ma'am.
Okay, why? Because, yes, exactly. Till 2007, okay? I think till 2008, I forgot. They used to write. Even 2009, even in some hospitals till 10 and 12. But after 2013, nobody is writing that because this ethical principle got the standard point that nobody have the rights to write like that. That you are not maintaining the confidentiality patient. Okay, if you were already writing over the profile of the patient that please wear gloves, patient is HIV positive, patient is having this problem. Okay, whoever communicable it is. So that is the respecting a client's confidentiality. So till that time, what happened? Basically, till that time, ethical principles about the confidentiality was not standard point. So after the ethical confidentiality or standard point being a respecting the patient confidentiality, we are or about medical teams are stopping writing that. Okay, so these are the points, these are the guidelines we are getting only from the ethical principles. Please remember this thing. This 3 points is mentioned in your paper. And advocating on behalf of client. You know something, Assamese people, you know what is Mamoni and Mazoni Asoni? Nowadays, so many schemes are there. Okay, what is that Mamoni and Mazoni actually? Please share. I know you already know. If you are not able to explain, even other people also, I'm asking what is Mamoni and Mazoni Yojana or schemes. I will help. Just it is a discussion class because you also know some of about ethics. I also know you have some doubt. I am just clarifying your doubt. So I am asking. Please go for it. What is this Mamoni and Mazoni Yojana or schemes in Assam? What is Adaroni? What?
Majoni scheme is for girl child.
Mamoni for?
Pregnant woman and newborn baby.
Okay, so what facilities they used to provide actually? Under Mamoni, they used to give a amount of money which used to be deposited in account of that child. Till 18 years of that girl child, that money used to be deposited. Okay, after 18 years, if the girl is not getting married, she can use that money. Clear? And under Mazoni, what is there? the mothers also used to get some benefits, and the family of the girl side, the child or the baby used to get whole facility from the hospital. Okay, even the kit, baby kit, everything they used to get. Why I am mentioning this? In some hospital in Assam, what happened? They are not giving those facility in EAC and CAC. This case happened in 2012 to 2014. Within this period, these are some issues. So that time what happened? Who was the advocating for those clients? The nurses. Because the nurse know the facilities what they are getting from the government, and the nurse have the rights even to go to the court and law. Okay, so you are the one who can even work as an advocate or advocating on behalf of your client. Am I clear? Am I clear?
Yes, ma'am.
Okay, so what are the 3 points you are going to mention under nursing ethics? These are being truthful with clients, respecting clients' confidentiality, and advocating on behalf of your client. Okay, please mention these 3 points. I'm telling again and again because these are some points, these are some wordings and sentences which you should not avoid, and these used to attract the examiner's eyes. Okay. So why this need is there for nursing ethics? Always remember when the question will come even importance of nursing ethics, please write the need also. Need only. Okay, need and importance here are the same. I am mentioning as same. So if it will come in need, you can write this point. If it will come as importance, you can write these points on. Okay, try to note it down in your copy. So in every class, just don't listen by sleeping everything. Okay, just sleeping and listening your teacher's lecture. It's not like that. Try to write. You know, by writing you can remember 85%. By listening you can remember 70% or 60% for some people. So please write it. Okay, guys? Fine. So what are the need or importance here? First point is helps in registered nurse to practice ethically. So now you know what is the ethical principles are. So based on that, all the registered nurse have to practice in that way. So practice means those 3 points, whatever I have mentioned. Apart from that, the practice is how you have to behave with your patients and what you should accept and you should not accept. Okay. Next is helps to identify the ethical issues in her workplace. Always remember in your workplace how you are going to identify the ethical issue. Something which is happening against the patient and something which should not happen against the patient. I think very recently some students from your batch only, from my post-basic first year, they have faced some problem. I forgot your name, who was C. The doctors actually haven't recorded the blood pressure and they just put blame on my students and some other nurses. I think all of you are aware on that. Yes or no? No.
No, ma'am.
Okay.
Yes, ma'am.
Last time when somebody, these things happened to somebody, I forgot the name. Lalun Chani or what? I forgot exactly. Okay, anyway, leave it. So these are, you should know that that time your points, own points. Always remember in any situation you protect yourself first, then the surrounding you. Always protect yourself. If you are able to protect yourself from any kind of surrounding, from any kind of situation, you will be protecting anybody. It doesn't matter from your family, from your friends, or from your well-wishers. Okay? So always remember, if you know the ethical things, ethical principles in hospital, nobody is going to be against of you. Because if you are going to verbally accept the doctor's orders and you are really going to put that order in practice, and after that, if doctor will say that they haven't give you order, you should know how you have to protect yourself. And if somebody in front of you in a mental hospital or psychiatric condition patient, they are using violence against them or they are just tying a patient in front of you, even if from your room, from the nursing staff, whoever it is, you should know what is the issues is going to happen, what is that you can take a step for that patient. Okay, and sometime what happened, you have seen very recently a doctor in, I think, Hazu, Nagaon, how he got bitten from the neighbors. Have you seen that?
Yes, ma'am.
Okay, so now what is the ethics he is going to? He is going only to ethics, with the medical ethics. So you should, if you are aware of your own ethical principles, you can go to the court. Okay, you can do a case on those things. So that is the things. Those are the things why you have to know ethical issues. Why you should know ethical principles as well. Okay. Next point is protecting patient right and dignity. This is very simple. You know what are the 14 rights of a patient. So always we have to protect that. And even you have to maintain the dignity of a patient. What you should talk, how you should behave, how you should respect the patient to maintain even the dignity. Because every person, every individual, every human being, we have some dignity. If it is affecting by any points, we used to get offended, we used to get hurt, we used to be very emotional. So remember, right and dignity is the rights of every individual, not only the patient in hospital. Next is help the nurses to respond ethical conflict. Ethical conflict is nothing but those are the things what I am going to explain in your ethical principle. That time I will explain it what is ethical conflict is. Next is guide for a professional behavior. What is professional behavior according to you? What is professional behavior? बोलो, professional